On behalf of the Foundation for a Healthy Kentucky,
Okay.
I'm going to go ahead and get started with our presentation, and hopefully they can join us. Actually, it's afternoon in the eastern side of the state. It is morning in the western side of the state where Dr. Phelps and I are. But where Dr. Van Brunt joins us, he is in California, so it's definitely in the morning out there. So I guess on behalf of the Foundation for a Healthy Kentucky and all three of us today, welcome to the Health for a Change webinar. We're going to focus today on addressing mental health in our communities, and we want to share with you that we are all colleagues in this work. Dr. Van Brunt, I will let you introduce yourself when I move over to you and allow you to move forward with your presentation. And then Dr. Phelps here in Owensboro, Kentucky at RiverValley Behavioral Health, I'll let you introduce yourself. I believe that Foundation was going to do so, but we're just going to jump right in, and that way, hopefully at the end, we'll have some more time for questions. So again, I'm Debbie Zerner. I am the Director of Community Engagement at Owensboro Health in Owensboro, Kentucky, and you'll hear from me a little bit further into the presentation. But I have two of my favorite colleagues with me today because we were asked to present somewhat of a high-level look at addressing community mental health in our communities, but also kind of funneling that down into what we're seeing here in Kentucky and somewhat of a case study here in Owensboro where we're engaged in a collaborative effort to address community mental health. So I think I'll just tee it up that way. And then Derek, if you will, Dr. Van Brunt, welcome to Kentucky, so to speak.
Well, welcome. Hi, everyone. Very nice to be with you today. And listen, this is a tough topic. Our country is in a national mental health crisis. It's playing out in the communities all across the country, in every state and every community. And we really have some good news to share with you today because there's some wonderful work taking place in Owensboro. And so we're going to start with a little bit of the big picture, just so we're all on the same page about what do we mean by mental health and what are just a few of the statistics. We'll do that quickly. And then we're going to really jump in and talk about the work that's taking place in Owensboro now and serves as, I think, a model for many of you to potentially collaborate. So very excited about that. I'm going to go ahead and share my screen. Probably the best way to summarize what we're talking about is population-based mental health. Today, our system of care is very good, but it waits until people get to a place in their lives where they typically need some kind of professional service or medication, and that's critical and valuable. But those resources are strained, and if we can add some early intervention and prevention to that and create more of an end-to-end population-based model, we can help address some issues related to health equity and improve mental health in our communities. So let's just jump right in. I think, first of all, just a couple of numbers, and I'm not going to share too many here. Pre-COVID, we've had mental health challenges in this country. And, roughly 20% of people any given year having a diagnosable condition, and a variety of sobering statistics like that. And along came COVID, and it really exacerbated our rates of anxiety, depression, loneliness, substance misuse, and a variety of other issues. For many of these conditions, it's elevated rates by double to triple what they were just 2-3 years ago. And very importantly, it doesn't go away quickly. We're likely to see these elevated rates in our communities for about the next 4 or 5 years. It's hard to know exactly. We know that from looking back at other disasters and pandemics like SARS and MERS and things like that. And while this is taking place, we have a major national behavioral health therapist shortage, about 250,000 expected. That shortage is expected to grow to about 400,000 in the next 5 years. So this is a big deal, right? We've got a lot of pain and suffering. There's a lot of expense. We've got limited resources, and we need to be really thoughtful about what we do here to help our communities. And it's not evenly distributed. Our vulnerable populations, frontline workers, people of color, LGBTQ community are being hit the hardest. I just thought I would take one topic like addiction and explain how complex these are. Addiction is not just a thing that sits by itself. If you unpack it, these are all contributors to addiction. So if you want to help someone in the community that might be in the earlier stages of addiction, you can't just say, well, let's just help you with one piece of that. You need to start looking at the whole thing, which sounds very difficult, but that's what we're going to talk about, what we can do. We can provide assistance with all of these kinds of topics in our communities in a way that's evidence-based. The other point I want to make quickly is, as we talk about mental health, it's not just about mental health and the pain and suffering associated with that and the lost productivity of that. The costs of physical healthcare delivery go up by many multiples when you intermingle mental health and physical health issues. Someone leaves maybe having had open heart surgery, but they develop depression, so they don't take their medications, and suddenly the costs for that patient are triple, quadruple what they otherwise would be. So let's not think that when we talk about mental health, it's just in a little bucket over here. It is very much involved with the whole healthcare system, and we need to get a handle on this. And meanwhile, we've got a very crowded landscape. For those of you that are in a position where you're trying to help a target population, people that live in a county or in a service area or members of a plan or employees of an organization, there are over 20,000 mental health apps and videos and programs out there where no one's kind of put a wrapper around that. How do you get your hands around what's evidence-based and what helps people sort of through their journey? So we did some research in this area, and I'm just going to share 2 or 3 quick thoughts, but I think these are lessons that you can take that I think are very pragmatic. Okay, so we got folks together out of Berkeley and Stanford, Harvard, a bunch of places, people out of industry, patients, and we worked for about 1.5 years asking ourselves, is it possible to help people help themselves and improve their mental health, but in an earlier kind of early intervention, prevention kind of way? That was basically the question. And the short answer is we found that you can. But we found a couple interesting things along the way. First of all, we did a survey of over 1,000 people, and we found many things you would expect, right? Some of the key topics that people were worried about in their communities: stress, anxiety, work-life balance, etc. But let me take you to the upper right. Very interesting. People that have anywhere from a medium to a high degree of interest in spiritual growth. And this was a very interesting clue. People are not just interested in managing a condition they have, like anxiety. They want to actually flourish in their lives. So this kind of got us going down the track of more research, and we had an aha moment. And the aha moment was when we found that approximately 3 out of 4 people that have mental distress are not seeking professional services. Now let's think about this. Our system is overrun. The average wait time for an appointment for a behavioral health therapist is around 3 to 6 months for a new patient. So what if 3 out of 4 people in that figurative line were to step out and be able to get evidence-based help on their own, which is what they're actually looking for? And if we can catch them a little bit earlier in the cycle, we could solve a lot of the backlog and reduce the pain and suffering. So basically, after the 18 months, we ended up with a checklist of this is what communities need. They need a system that's available for all residents in the community or members of a plan, employees of an organization, students of a school, etc. It has to not just address mental health topics like anxiety and depression and burnout. It has to help with that, but it has to have a positive framework and help people see themselves in a more positive light and build resilience. It's got to be evidence-based. It has to cover any topic where someone is in their own journey. There can't be any sort of wrong door where it's like, no, this only helps people with these issues. You got to go over here for that. Connect people to services and clinicians where they need that. That's critical. This needs to be a seamless end-to-end kind of a system. And that's what they've done in Owensboro. That's what we're going to show you in a minute. And it's got to be anonymous and safe. So it was really interesting. I'll just add one more thing, which is I kept using the term positive framework. So Corey Keyes over at Emory came up with this very simple model and said, look, most people think of mental illness as such sort of a line. It's like you have mental illness or you don't have mental illness, but it's just not that simple. You need to add a second dimension, which is whether or not you're flourishing or languishing. Anyone could be anywhere on this matrix. You don't think of yourself as on the horizontal line with a label like I'm burned out. That does not capture it. We know people that could have mental illness and be flourishing. And we know people that don't have any mental illness and they're languishing. The key is to help everyone move up and to the right towards flourishing. This gets people motivated. That's where they want to be. So it's sort of like a football analogy of playing defense and offense. We need to block, we need to play defense and help people manage their conditions. And we need to play offense and help them move towards flourishing. And this model, if you keep this in mind as you're doing your community-based health program planning, is really going to help you with selection of topics, getting engagement, all the kinds of things that people have trouble with. So let me close my introductory comments with this. We've sort of arrived at what we call a population mental health model. For the 3 out of 4 people in your communities that have mental distress, let's give them evidence-based self-care. Let them help themselves and their loved ones, their children and their parents, and give them the tools to do that. And for the 1 out of 4, approximately, that need professional assistance or medication, let's seamlessly pass them over to the right and let them engage with professionals that we're going to hear from right now so that we can create this sort of seamless system in the community. So let me stop sharing my screen. I'm going to hand it over to Debbie and Lionel and ask them to talk about what they're doing in Owensboro. And then I'll come back in a few minutes and show you some of the technology that's in place.
Thank you, Derek. Appreciate that so much. That frames this conversation in just beautifully as we think about the tools and the collaborative efforts that need to take place in our communities, but just really looking at it from a high level and in a different perspective. You just mentioned talking to a professional, and a professional he is. Dr. Lionel Phelps from RiverValley Behavioral Health is a clinician, and he is going to share with us next. So Lionel.
Thank you all very much just for taking a little bit of time out of your day to allow us to just share some information about some of our experiences and kind of some of the direction that we're going. So I've got kind of a catchy little title here that I took from a recent presentation that my CEO and I did for MHCA, the last conference, talking about some of our work with establishing mobile crisis response, at least in our region. So what you see over to the right of this slide is our iconic blue bridge in Owensboro. It connects Kentucky with Indiana, and it's kind of a symbol of our area. So I want to talk a little bit about kind of the structure in Kentucky. So in Kentucky, we have regional community mental health centers. I know that a lot of states, their structure is a little different when it comes to community mental health. But we have really set up a very robust safety net in Kentucky, and we get a lot of support from the Department of Behavioral Health in Kentucky that allows us to expand, grow, be able to look into new opportunities, to be able to kind of reach populations that can be really difficult to reach. So we're over kind of in this northwestern area of the state. So we cover Davis, Henderson, Union, Webster, McLean, Ohio, and Hancock. So we have that little kind of slice here in the state. But community mental health centers are really, they've been around since the 1960s, and they have provided the safety net, as I mentioned earlier, for the community in which where we do have a lot of individuals providing outpatient care, providing substance use disorder related kind of strategies. Whenever all else fails and the person does not have anywhere to turn or outpatient isn't working, we provide the crisis response for those individuals. And we take that very seriously, and we try to find new ways to reach those individuals. So I want to talk a little bit about some of the things, and this is preliminary. This is information that I have kind of rudimentarily gathered since the pandemic. There a lot of things were unpredictable, but I want to share a little bit about some of the things that we noticed. So this came from people, first-time appointments, people who are already established in treatment, people calling the crisis line and kind of sharing. People can call. You can call 988 now anonymously, but we still gather information, and we kind of gather this. We gather this data in a way so that we can kind of understand what is the trend, what kinds of things are people struggling with currently. So what we found was that there was a major, and I do emphasize major, increase in the number of adults who were reporting an increase not only in the symptoms, but the acuity of the symptoms, lasting longer, impacting more areas of their life. And particularly, Derek showed you a slide earlier that showed the high percentage of people struggling with stress. That seems to be the number one reason that people call, followed by anxiety. We know that about 1 in 5 people are affected by anxiety in any given year, and depression and insomnia. Interestingly, I saw a report by the American Psychological Association recently that said that psychologists in general haven't been well trained in treating insomnia, and that they wanted to do something about that. During this pandemic and post-pandemic phase, we noticed that a lot of people were reporting major problems with sleeping. Also, increase in use of routine drinking, use of drugs in order to cope with the fears during the pandemic, the uncertainty. Some people using those chemicals in order to sleep. We also, to our surprise, noticed a big spike in the number of adolescents calling and texting our crisis line, particularly those under the age of 12. That was very new. Also, we saw a lot of adolescents reporting. We had a recent study here done, a needs assessment done with school-age children, and noticed a lot of high school students talking about their mental well-being still being, of chief concern, especially during this time period, even though they went back to school. But that prolonged period when kids were out of school seemed to be the chief contributor to some of these problems that still exist. So major increased stress, anxiety, depression, overall diminished wellness reported by healthcare workers. We created an app during our, right in the middle of the pandemic. We did a cooperation with the University of North Carolina Medical School to kind of assess our employees to see what their own stress level was. A surprising number of people were using that app and reporting that they were really struggling with things like sleep and anxiety and just general stress. So we came up with a strategy in which we would kind of monitor this data and then reach out to those. We had a core team of individuals that would reach out to those employees to find out what we could do to support them. So what are some things that we did in order to counter these effects? Right in the middle of the pandemic, we added a 24-hour, 7-day-a-week, 365 days a year mobile crisis team. This is one of the things that we've been working on for the past decade, but it was very timely, and it coincided with some federal funding that we received to help us move toward becoming a certified community behavioral health clinic. We also increased our call center staff in preparation for 988, or the 3-digit national dialing for the National Suicide Prevention Line. This was really very helpful in order to get to those calls more quickly. Also to be able to spend more time, because one of the things we noticed as well, a lot of people were spending more time or wanting to talk to someone for longer periods. We really rolled out telehealth capacity. We were chiefly using telehealth for most of our prescriber services, but we rolled it out across the board to do everything from involuntary commitments to routine psychotherapies. We even used it for some group work. And one of the reasons for this information that we're sharing with you today is that we added Credible Mind. And this has been a really amazing resource. And I can tell you just firsthand, the information that it has provided is something that we can trust. It has some of the best practices, some of the most evidence-based information that's out there, provided by professionals, people who research these areas. And it has been something that we've been able to give to people as they call or when they come in, because, you know, a lot of times people want information on their own, or they want to seek information. And I think we've all experienced the situation where people want to Google their symptoms, or they want to Google information about how to help themselves. You know, we can't always trust what comes back with those types of searches. So we guide our employees, we guide our clients into using Credible Mind in order to get reliable, useful information so that they can employ those self-help strategies better. We also, during this time, we were able to strengthen our relationships with our regional hospital, our health department, our schools, and our law enforcement so that we could increase continuity of care. I thought I would share a little bit about some of the challenges, particularly for us, being in this rural urban fringe that we live in. We have some counties that are extremely large. For example, Ohio County is 600 square miles. It can take an hour and 15 minutes to travel from one side to the other, depending on where you're going. And there are very, very few mental health providers in this county. They have limited access to crisis services, and there are lots of gaps identified in treatment and social services. Also constraints with finances and then staffing resources. So some of the strategies that we've been able to incorporate, especially in our rural areas, is to build more health coalitions so that we can share and offset the cost and the burden. We've incorporated more technology. I'll give you an example of something that we did recently and are in the process of still doing, is that we received a small grant that specifically addressed substance use disorders with our homeless population. We are working with 4 of our local shelters, and we have deployed tablet devices that at a push of a button, those individuals can reach our mobile crisis team in order to do mental health and substance use disorder assessments, and to be able to get them into treatment faster. We don't want those individuals to fall into that loop-de-loop of barriers that often people are faced with. Derek talked a little bit about that when he talked about the shortage of mental health workers. So incorporating this kind of technology really does increase that ability for us. We use more mobile devices, tablets and portals that patients can review information, or clients can review information and kind of make their own decisions, change appointments, and those sorts of things. Avoiding reinventing the wheel. You know, it's a waste of time in order sometimes to build new things when there are pre-existing programs that we can utilize. We've also found that sometimes in order to meet the needs of our staff and our clients, we have to adjust staffing patterns in order to accommodate both. And something that's very, very critical and vital to transition care is doing that follow-up. Something that we added as part of our CCBHC movement, our expansion of services or core services, is we added a recovery care nurse who follows up with patients who miss appointments, or you know, who've dropped out of treatment in order to get them quickly back into treatment. So I thought I would share something really simple but effective. So Derek alluded to this when he talked about, you know, people can be experiencing mental illness, but also be flourishing. I think that's very, very important to emphasize. So for example, we can have someone that has been, you know, dealing with their depression symptoms for 15 years, and they feel like they deal with them pretty well. And maybe we're still, as clinicians, trying to address those symptoms. And maybe all that person wants to do is be able to go to the grocery store unassisted. So I think that's very important that we look at these components. Autonomy, having confidence in my opinions, feeling I'm in charge of my situation, environmental mastery, personal growth, new experiences and challenges, positive relations with others, sharing time, and also feeling like you have purpose in life. I'm not aimless. And I think that's what's so good about employing self-help strategies. I know that we have trained now over 2,000 individuals in our community in mental health first aid. And one of the steps of mental health first aid for helping others is to encourage them to use self-help and other support strategies. And so we want to point them toward credible information that they can achieve that. I don't want to bore you with too much data. I love data, but I thought I would share a little bit about some of the, this is kind of what happened right at the end of the kind of the pandemic phase for us. We were providing about 60% of our services in person. We were providing 30% by phone and 10% through Zoom. If you would have told me 5 years ago that we would be providing those services to 16,000 individuals in a year, and that 30% of those would be successfully done over the phone, I would have, looked at you cross-eyed, because there's no way that I would have thought that was possible. Now that we've moved back to more in-person services, it'll be curious to see how people benefit from still being able to utilize these technology services. So 75% of our services are provided in what's considered an urban area, and 25% rural. Before the pandemic, prior to 2020, that number was about 20% urban and 80% urban and 20% rural. So it seems that we've reached more individuals in our rural areas. This is something that I'm especially proud of. We know that since 988 implementation, a lot of states and communities are rolling out mobile crisis response, to get that face-to-face care for individuals who are experiencing a crisis. So what we found was that we were utilizing law enforcement an awful lot, in our crisis response, because, well, quite frankly, that's all we knew to do. We didn't have a way to really get immediate help to people. At baseline, so prior to implementing mobile crisis, we were calling, on average, law enforcement about 55 times a month and asking them to check on individuals. By the end of, after implementing mobile crisis in 2020, by the end of year one, we cut that down almost in half. And by the end of year two, we cut it down to averaging about 11 a month. Talk a little bit about some of the boost in mental health and SUD funding. So there are all sorts of funding sources out there. Some of the biggest come from federal money. Some of that money goes to the states, and then they kind of divvy it out depending on where the need is, or to make it more competitive. So Health and Human Services announced funding for implementing mental health in nursing homes. There's been some money around 988 implementation. That went live about 11 days ago, and we have already seen a doubling in our call volume in 11 days. Also, in tandem with that, increasing capacity for mobile crisis response, harm reduction for SUD. There is still funding for helping states move toward the CCBHC model, building community crisis response, communities of recovery, and also medication-assisted treatment. We started medication-assisted treatment 2 years ago with some skepticism. It grew very slowly, but I can tell you that now We're adding a second MAT site and also looking at a third. So this has really filled a gap, especially with opioid related disorders. Thank you all very much for letting me be able to share a little bit about some of our personal experiences. Debbie, I'll turn it over to you.
Thank you, Dr. Phelps, so much. You just bring such expertise and such a personal perspective to this area, and we just appreciate you so much. So for those of you who are listening or watching this webinar today, you can see the value of relationships and collaboration, even just by what we've heard so far. And where I'd like to take this now is just to tell you a little bit about how this came about in Owensboro, a little bit more into the collaborative process. And then I'm going to turn it back over to Derek to share just a little bit more as well. So I'm going to share my screen if I can really quickly. There we go. Okay. So if you're with me, I'll just kind of take off from here. So it's interesting. I titled this View from the Outside In, Addressing Community Mental Health. And when I first looked at this, and even Derek and I had shared with some folks in Cleveland at a conference, I had that reversed. And the more I've thought about it, I wanted to reverse that. And because we're looking at this from a community aspect. If we look at it from a population health aspect, we're talking about all members of our communities. And so we have to be focused on what's happening to our community members. They are potentially coming into our hospital or into our outpatient and utilizing our outpatient setting and our clinics within that world. So when I started looking at this title, I thought, let's take a different perspective on this and emphasize to you all who are listening that let's take a look at our communities, let's take a look at our own patient population, and then we'll go from there. So let's see here if I can advance it. Nope. There. For those of you who have never been to Owensboro, I wanted to share this lovely picture of Owensboro Health Regional Hospital. We are located in Western Kentucky. I'm pretty proud of this picture. Lion and I were talking about it before. Love to have you visit us in Owensboro, but we built this hospital we moved in June 1st, 2013. So we're about to celebrate our 10th birthday. This is where we're located. In Davis County. We serve an 18 county region, including 2 counties in southern Indiana. So we're looking at that far northwest region as Lionel shared with you. This is a picture of our outpatient medical offices on the campus of Owensboro Regional Health. And I was intentional in showing you both the hospital, but then our outpatient offices, because we're talking about both what happens on the inpatient side, our outpatient side, and our community side today. Looking for the cursor here. Okay. So let's talk a little bit about hospital-specific requirements, in that if you are joining us today from a hospital, a nonprofit hospital across the state of Kentucky and certainly across the nation, you know that hospitals must conduct community health needs assessment every 3 years, and that is a requirement under our community benefit requirements and 501R of the IRS regulations. That is a document that we have to do, but we take that very seriously here at Owensboro Health. And over the past several cycles, we have seen mental health rise as a prioritized health issue. Except this year, when we just finished our most recent community health needs assessment, it rose to the top, and it was repeated in every focus group, in every individual primary interview, in every assessment and survey. It rose to the top. And of course that stands true as you heard Dr. Van Brunt and Dr. Phelps talk about this issue. It has been deemed a public health issue, a public health crisis. And so I'll allude to in just a few minutes how we're also pulling in our public health department. I won't go too much into the COVID-19 pandemic. I think Lionel and Derek did a beautiful job in explaining how the pandemic simply exacerbated what existed before. certainly there has been mental health illness, mental health conditions, and just state of of poor mental health well-being before the pandemic. But what has transpired since that time and is ongoing, and some would argue that we haven't seen the worst of the pandemic's effect yet. So we are dealing with this, and that's why we're here today, just to talk about some of the things that we're doing. We also, as a healthcare system, and Lionel, you alluded to this just a little bit, you know, our healthcare workers have really faced just enormous stress in the past several years. And not that healthcare workers don't do that on a regular basis, didn't, you know, experience that before the pandemic, of course, and will always experience that. But the pandemic brought about some real stressors to healthcare systems. And now we're seeing that in terms of healthcare shortages, being able to take care of oneself in order to take care of someone else, et cetera. Our own team members, whether you were clinical or not, across the board, and we employ 5,000 employees at Owensboro Health. We have 3 hospitals, not just in Owensboro, but in Grayson County and Muhlenberg County as well. Our own team members are hurting. And again, as we've talked about already today, those can be things such as stress and burnout, but it can also be things about how we were taking care of our children, you know, during the pandemic, or how we were coping with the other million stressors that seem to be hitting during that 2.5-year period, politically, environmentally, safety, all of those things were hitting us. And so we really had to look at what we were doing and what our internal needs were. Our Owensboro Health Foundation actually pulled all of us together within our organization to seek a HRSA grant to be able to take care of our own employees. We did not get that grant. However, this is what transpired. It was so supported throughout our organization that no matter what, we were going to see this through. And so what's transpired since then is an enormous number of resources that we've put forth internally to help team members take care of one another, take care of themselves, their family members and friends, et cetera. And we have seen an enormous response to this. Seeking self-care, everything from our wellness and renewal rooms on our patient floors, to also incorporating mental health first aid, teaching that to our own team members, to the use of Credible Mind, which has just increased on a monthly basis since our launch, and we'll talk about that a little bit. So when I said we started with our community health needs assessment, knowing that mental health is a priority health area, and looking at what transpired in the pandemic, knowing that this was existing, this issue was exacerbated in the community, that's when we turned inside and then back outside. So this is just a screenshot of our website. As if you are on here and you're from representing a hospital, you know that these these community health needs assessment must be posted per IRS guidelines. And this is what ours look like. And historically, you can look back and see that mental health over the course of several years and several cycles have highlighted mental health as a priority health issue. So let me talk about let me go back one, a little sensitive here. Nope. There. Let me talk about pre-pandemic for a moment. Dr. Van Brunt and I, we've worked together well since about 2010. Yeah, we truly have on community health and addressing community health. So about 2016, 2017, Derek was introducing this concept of Credible Mind. And again, this is pre-pandemic. And knowing that community mental health was such an issue pre-pandemic, looking at what available resources, and at that time, Lionel, you'll agree that all of us were talking about the lack of of clinicians, the lack of psychiatrists, the lack of social workers, the lack of trained clinicians. And we've been after that cry, as many of you all probably have been for years. We've talked about the lack of available resources. And we haven't made a lot of strides in those areas. And the pandemic has made the healthcare workforce across the board, as I said just previously, we all are experiencing a shortage. But we continued to beat that drum. And when Derek approached me about talking about a tool that we could actually launch and get to our community members so that they could have access to credible, vetted resources, you can bet that I was listening to that. I brought that concept back. We looked at that internally. We brought in some external partners and said, what do you think about this? The pandemic hit. We still are in need of clinicians and other providers, and we still had a tool that we were contemplating and had not launched. So we reached out to our partners with RiverValley. We reached out to our own Owensboro Health Foundation and said, we can launch this tool to get something in the hands of our community members now. It is not the panacea. We have not alluded to that today. We have not said that. This is a tremendous resource that we can put in the hands of everybody right now to be able to take care of themselves. And I won't go over the statistics that Derek and Lionel shared, but many of us are looking for something to help ourselves. And the alternative to that is not. We have nothing, or rely on our own vices, or rely on our own resources, then we don't know what's good and bad. So you see how valuable this was to us. So this started a really interesting community collaborative journey. We launched this in August of last year, so it has not been launched yet a full year. We've had over 7,000 users to this system. We've had new users come on board every month. We've had so many people take assessments on here, just self-assessments, and really looking at these resources, from blogs to videos to art, to various checklists on here to be able to help themselves. To no surprise, the topics that people are searching, and we get a monthly report about this. And so we all come together and meet: depression, anxiety, flourishing, languaging, stress, burnout, sleep. Everything you heard prefaced before me pointed in that direction. And that is exactly what over 7,000 users of this are looking at. And so Derek's going to briefly demo this. And so I want to keep my comments as brief as I can, because I want to share with you that this is a tool that we have been able to launch. You'll see on their community resources, and that is a link that we're able to connect anyone in our communities, 18 counties, with immediate resources, such as the crisis line, such as their own community mental health center that serves them. So RiverValley does not serve everyone in the 18 counties that Owensboro Health serves. And so they provided the information of how an individual could click one link and get to the local resources that serve their areas. Real quickly, where do we go from here? Obviously, the conversation and the dialogue has increased tenfold in this community collaborative. We also applied to the American Hospital Association Hospital Community Collaborative. And this year's 2022 cohort is focused on community mental health. So what we applied to do would be to have RiverValley, our Green River District Public Health Department, and Owensboro Health engage in a 6-month learning collaborative. And that is truly what it is. It's a learning collaborative that we come together once a month. We're looking at those things that each of us provide. We're learning from people across the nation. We're going to really be able to put some ideas and concepts together on how better to utilize joint strategies to be able to impact community health in this area. So we're pulling in our community mental health center, our hospital health system, and public health, because again, it has been deemed a public health crisis. So we're pulling us all together to learn from one another and learn from people across the nation to be able to see how else we can impact the mental health of our communities. And so that's where we're going from here. I don't have a solution list for you. What I hope to bring to you today is the fact that if you take the initiative to be able to really roll up your sleeves and look for these resources, ask the questions, and be able to sit down at the table and share that with one another and collaborate at a community level. And this is hard work. I'm not going to say that this is easy work. This is not about sharing PowerPoints and then taking a few concepts. This is really trying to dig down to say, what else can we do to create the seamless system of care in our communities that engage us all, and we can be at every access point within our communities to address community mental health. So that's what I have to share with you, is really the encouragement across this wonderful Commonwealth and beyond to be able to work together collaboratively. And Derek, I'm just going to pass it back to you to close us out. And if there's any questions we can ask, we'd be happy to answer those as well. But I do want to give you a chance to close this out for us.
So I'll be brief, but let me quickly show. We've talked about what we can do out in the community to help people with evidence-based self-care. Imagine the power of moving that locus of information where people can help themselves, those 3 out of 4 roughly, and then connect them into services as needed. So there's a lot here, but this is what they're doing here in Owensboro, and it's just one in this collaboration. So I'll show 2 things very quickly. First of all, of course, there's sort of the proverbial search box, but just to give you a sense of the breadth of topics, there are over 200 mental well-being topics here. So in areas of traditional mental health, things like what we've heard about: anxiety, stress, depression, eating disorders, PTSD, etc. But it's much broader than that. And people are suffering in our communities. We have questions about parenting, going through periods of grief. Maybe someone was incarcerated and they're re-entering society, or they're going through a housing transition. They're going through emotional health related issues, like they're just feeling lonely, on up through positive psychology and spiritual growth, altogether over 200 topics. For each of these topics, what we do is we basically say, we want you to know that you're not alone, and there are things you can do that work. And I'll give you a quick example here. This button here is very popular. What helps? If you've got anxiety, which is the #1 search topic, by the way, these are all things that you can do that help reduce anxiety. I have a family member who has anxiety, has been medicated and received therapy for that. I went through this list with them. 2 things jumped out. It turns out that if you have good sleep, so good sleep hygiene, that reduces anxiety. And it turns out listening and playing music is very therapeutic. This person plays a half hour a day of guitar, has good sleep hygiene, finished with no more meds, no more therapy. That was 2.5 years ago. Evidence-based self-help. Now imagine everyone in the community, not just for themselves, but maybe helping someone else, can immediately go, yeah, I didn't realize that sleep was something that can help cause anxiety. I'd love to see an app or something that would help me, sleep better, free app. And boom, here they are, and they're all rated for you. And we've, this system is vetted over 16,000 resources, but they're all teed up for you, the individual, to sort of find what's right for you. The other thing is we're all not the same. Big, shocker, surprise, right? So if you've got anxiety, you can hit this little personalized button, anyone in the community. And maybe your anxiety is related to a parenting issue. So I'll just click that. And now the resources that are presented to you are those that help parents related to anxiety. Do I have separation anxiety? And again, all of these have been clinically vetted. But maybe it's a very different kind of, maybe instead of parenting, I'll just choose one different example here. Maybe you're a person of color. and you're going through some periods of anxiety, and you'd like to hear people that are going through similar issues that are causing anxiety and what they're doing about it. Again, vetted resources. So this is very powerful to help people of all different types. And you'll note that as we're here in anxiety, we can bring up these wonderful resources that are available locally. So it's self-help plus what's there locally, the 988s, the safety nets, the call centers, the telehealth, all of those can be part of a seamless interface for the end user. So the last thing I'm just going to mention, Dr. Phelps mentioned that, sometimes people just want to get a sense of where they are in the process. There's a whole library of assessments. Most of them only take 2-3 minutes. Am I sleeping well? Are my off days a sign of depression? So you fill these out, you get a risk score, and depending on your risk score, you might be moved towards more services or more self-care. So this becomes a giant triage engine for your community. So there's lots more to share. I just wanted to give you a quick visual.
Hey, Derek, did you eliminate that? Can you put that back up real quick?
Sure.
Because I want to share with everybody, as I said, RiverValley and Credible Mind and team members from Owensboro Health have come together on a monthly basis. And we talk about what topics that have been really relevant to our own organizations, as well as those we're serving. And one of the, Derek, you're not sharing that screen yet, but one of the things I wanted to point out to you, and sadly enough, that in Owensboro we have experienced quite an increase in gun violence. And so we reached out to Credible Mind and said, are there resources that you can help us with? And as you see, front and center, they researched those resources for coping with gun violence. And they're very strong resources and very, very helpful in terms of talking to your children and coping with traumatic events, etc. I will note that in December, as of actually December 10th, when Western Kentucky all the way up through Ohio County, Louisville, and on over experienced such devastating tornadoes, we instantly went to Credible Mind and said, can you give us information on dealing with that traumatic event, such as a tornado and tornado crisis and those kinds of things. And we popped that up there front and center as well. And so we're trying to really listen to what's going on in our communities and then work together to be able to provide those resources that are quick and available. One quick story, Derek, and I've shared this with you before, is that we have these little business cards, if you will, made up of resource information, including Credible Mind. And one of the ladies over in the Bremen area told an emergency management professional that she really didn't have access to any of her technology, but she had one of those cards, and one of those cards said, "It's okay not to be okay." And she said, when I get everything back in order, she said, I'm going to check out this resource. She said, but right now, the best I can do is keep that in front of me. And just as a reminder to me, it's okay not to be okay. And I think, as we close this today, it is okay not to be okay. But we've got to stay the course in this journey to be able to provide resources to our communities and to this Commonwealth of how to help impact community mental health. So I just appreciate the sharing that, Derek.
I thank you for that. And, and it's working, folks. So this is for folks out in the community. This is what's happening on these surveys. They're saying they better understand their mental health strengths and challenges and feel better about themselves. But look at that bottom number, roughly half saying they're making positive behavior change. That's what we want to help people with. So it's so exciting when you see that. So let's just close here and just say you can have all these different audiences depending on where you sit. If you're looking at the county or a region, you have residents, you might be worried about your patients, but you can provide them with evidence-based self-care, send them through to the kinds of services that Dr. Phelps explained, and there's all kinds of analytics to help with that as well. So the three of us are here to answer questions, not just today, but to invite a conversation. and to say, as you're going through this journey, if it's community-based technology for self-help, if it's how some of these professional services are organized, we're all in this together. We've got pieces that are working today, but there's lots more work to do, and we wish you luck, and we hope to be talking with you in the future.
Awesome. Thank you three so much for presenting today. This has really been some great insight from your experiences. Dr. Phelps has been helping answer some questions in the Q&A that we've gotten so far, but we do have a couple I want to touch on. So one person wants to know, is there any way we could get a copy of your mental health assessment survey? So I will be sending out a on-demand version of this webinar when it's done, and I can include the link to, all of those assessments we just saw, but does anyone want to add anything more to that?
If by the assessments, that library of assessments that I was showing, I would be very happy to take that. If you just share my contact information, and I can talk with someone about how to access that.
I will share that the mental health assessment is one of the most popular things that we notice that our own employees and staff like to do. I think people like to have a sense of control, as I mentioned, the 6 components of mental health. They like to have a sense of control over kind of seeing their own results and not someone telling them what's wrong.
One person wants to know what is the best way to get Credible Mind into our community, and a couple have asked about the cost. As far as getting in contact, I will be including all of our panelists' contact information when I send out the on-demand version, but I don't know if you want to talk about costs here, or
I mean, we'll take that offline, but it's not an expensive system. It's, 10, 20, 30,000 a year, depending on the size of your community. And that's it. Everything, services for engagement, analytics, the whole thing. So, some of you will just have that funding available, or you can work in a little collaborative where it's inexpensive for each member, or there are grants, and we can help point you to some sources of funds for that.
Yeah, so I'll include all of that contact information. So for
Allie, I'll be happy to share our experiences over the years with the developer and the work that they've done and this process as well. And again, collaboration is the key, because when you start really pulling those resources and looking how this could be supported, it's a great tool.
Mm-hmm. And then one other question we have is, are there any other groups working right now to adopt this model that you know of?
When you say this model, are you talking about this tool? Because this model, if you will, is a journey for us, and everything that you heard Dr. Phelps describe in terms of the mobile health clinic and their outreach and the medical, the kind of the navigator follow-up, et cetera, the crisis line, what the hospital is doing, all of that is part of our journey. So in my mind, that is a model. We're just trying to work ourselves through it. Credible Mind is a tool, one of many.
Yeah. Now that tool is in place right now in about 15 different states and 30 or 40 implementations. So it's pretty broadly used at this point.
Awesome. All right. Are there any more questions? Let me see here. Awesome. Well, we have gone over just a couple minutes on time, but we did, start a few minutes late. Apologize for the technical difficulties at the beginning. Thank you again to the 3 of you. This has been great. Like I said, I'm going to send out this as on-demand version. I'll include all of their contact information for anyone who wants to, get involved and maybe bring Credible Mind or any of these tools into their community. So,
or Allie, if anybody has anything to share with us, please.
Yes.
Yes.
And thank you to the foundation for giving this opportunity of best practice sharing. We all need to help each other. So thank you.
We are happy to do it. Thank you all.
Great.
Have
Thanks
a good
so
day.
much. You too.
Bye, team.
Bye.
Bye.